The general practitioner can be a really, and probably should be, the sort of central, pivotal point of healthcare coordination for young people with chronic conditions. I know it doesn't always work that way. I know from what young people have told me, from what some GPs have told me too, that when a young person's been diagnosed with a chronic condition in childhood, often it's the hospital team that's provided the main care. They go back and forth and in and out of hospital, and they only really know that healthcare team, and the GP might have been a little bit peripheral to that. Once they move into adolescence though, the GP can become a really important, what I would call a medical case coordinator. And what that requires on the GP and the specialist part is really good communication. And what GPs can do, and a lot of GPs I know do this and do this extremely well, is be a sort of point of reference. They can sort of interpret some of the medical jargon and the technical stuff for the young person and their family. They can advise about appointments and who they need to see next, and explain who the different members of the health team are, particularly when they're moving from one setting to another. So GPs are not just there to deal with the sort of more trivial medical problems. The GPs actually have a much more important role to kind of translate, to coordinate, and to facilitate access to some of these other specialist areas, particularly when you're moving into a new and foreign environment.
Young people often say their GPs don't know anything about their condition. I think that's partly because when they were in a paediatric hospital, often the GP had little role to play. And in transition, we encourage GPs to get involved so they do know about the condition. They mightn't be expected to prescribe or manage it, but at least they understand what sort of review that young person will need, why they're on that treatment. They can pick up worrying signs that might mean that young person needs to be more urgently reviewed by their specialist. And I really think that GPs have a very vital role to play, and they need to be helped by treating teams in both paediatric and adult hospitals to understand conditions better. They don't need to be the expert, but they need to have that broad knowledge.
I like that I know my GP really well now. It's kind of a pretty easygoing doctor, and he definitely understands, whether I need medication for, I need antibiotics for the flu. He knows that, what's going on with my CF, will that affect that? Will that affect any other medication that I'm on? So to have someone that has a really good knowledge, not just about general health, but about, your chronic illnesses, that's quite important, so they can prescribe the right things to make sure that nothing clashes with conditions and with illnesses.
GPs can also, for the young person, be someone they can go to discuss other things that perhaps their medical team in the hospitals haven't thought about. And something I hear a lot about from young people with chronic conditions is that, well, the team was fantastic at treating their medical problem, but they're now thinking about sexual relationships, or they're starting to look at other things that young people do, go to parties and maybe, experiment with alcohol or other drugs. And that's what a GP can certainly do well, that they're there for young people to go to for information, to talk about these things confidentially.
Turning 18, the milestone of becoming an adult, I obviously wanted, to talk to my doctor or to anyone about things on my own, and I didn't need my mum there with me all the time to sit there and listen to my conversations about drinking or sex or partying or anything that, my doctor would, tell me not to do or to avoid, especially my GP. I mean, I definitely didn't need my mum there for that. I didn't need that death stare. My GP's been there for a long time. She pretty much helped me through everything. When I went through that drinking phase, through all that kind of stuff, she was just there to talk to. She was more there for me psychologically than anything. She was obviously there for the, the illnesses I had or, whatever like that, but she was just the most amazing person to talk to. She's probably the most important doctor I've got, actually, out of all of them.